You are the FI1 for hepatobiliary surgery and have just arrived on the ward. For the morning's handover, you take a seat next to the specialist registrar, SPR, who is complaining that they have not had enough sleep last night. As they are talking to you, you think you can smell alcohol on their breath. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask to have a quiet word with the SPR in question after the handover and explain that you are concerned. B. Confront the SPR in the room before the handover starts and explain that you think it is very unprofessional for them to come into work in that state. C. Do nothing about it. You are probably mistaken and the colleague in question is more senior, so it is likely no one will believe you. D. Go to your educational supervisor for advice about whom you should voice your suspicions to. E. Speak to your consultant, who is also present at the handover, and voice your concerns in private. Answer. Ga. A. D. B. Chi. As a doctor, you have a duty to respond promptly and appropriately if you think that patient safety is being compromised. It is possible that your SPR is still under the effects of alcohol, or at least not in a fit state to be making decisions and looking after patients, even though the drinking did not occur. In the hospital, your personal conduct outside the hospital is relevant to your job if it is impacting your ability to work. Option A is the best response as you have a duty to maintain good working relationships and you have no evidence that what you suspect is true. It gives your colleague the chance to explain, which is courteous and still immediately addresses a potentially serious situation. Discussing it with a more senior colleague. Options E and D could also be appropriate if you're unsure of what to do, and your consultant E will be slightly more preferable as there are immediate issues over patient safety. However, it is best practice to talk to the colleague in question first. Confronting the SPR in the meeting, B, would be unprofessional, and you do not have proof yet of your suspicions. However, your duty ultimately lies with your patients, and to do nothing could potentially lead to harm. Therefore, option C is the least appropriate response. You are an FI1 doctor driving home from a shift in the emergency department. While you're driving on a small country road, you see a car that has had an accident and hit a tree. There are 2 people inside who are obviously in pain and have sustained injuries. There are no other cars passing, and no one has stopped to offer assistance. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Assess whether it is safe to stop your car and provide assistance. B. Continue driving as getting involved in the situation could be dangerous alone. C. Stop your car and offer assistance. D. Telephone 999 and inform them about the accident before continuing on your journey. E. Telephone 999 and then approach the car to offer assistance. Answer. Ga, Chi, A, D, B. As qualified medical professionals, doctors are likely to come across situations outside of work where they could usefully provide assistance to individuals who have had accidents or suffering from medical condition. While UK law states that there is no legal obligation for doctors to stop at accidents, the General Medical Council, GMC, does offer guidance. Good medical practice states you must offer help if emergencies arise in clinical settings or in the community, taking account of your own safety, your competence, and the availability of other options for care. In this scenario, you have come across 2 members of the public requiring urgent medical care. The best option involves confirming your own safety first, but you should proceed to offer assistance to the people in the car. C. Option E may be a sensible decision. However, assessing the situation to acquire further derails may help the operator to assess the urgency of the situation, so E is only the 3rd most appropriate response. Although you're not legally obliged to stop, GMC guidelines suggest that not offering assistance, B, would be inappropriate. Alerting the emergency services, but continuing on your way, D, ensures that the people involved in the accident will receive care, but not offering assistance yourself would be incorrect if it was safe to do so. Any assistance you do offer should take account of your degree of training and other professionals available at the scene.